Types of airways. First one, oropharyngeal airway. It's a rigid curved device placed in mouth to prevent the tongue from occluding the airway. The main indications are unconscious patient with airway obstruction, especially in case of large tongue, excessive nasopharyngeal tissue or in copious secretion. There is a need of airway. Another indication is it's used as a bridge to intubation. The main contraindications of oropharyngeal airways: conscious patient with intact gag reflex. The measurement of oropharyngeal airway, it can be assessed by measuring the corner of the mouth to the ear lobe. In this picture, you can see that firstly we are measuring the size of the airway. So here from the corner of the mouth to the earlobe we are assessing, and the size we are understanding. After that we are inserting the airway. For adult, insert concave up or concave lateral until past the tongue, and then rotate until concave down. That is the procedure we are using for adult. Next one is nasopharyngeal airway. Nasopharyngeal airway is a soft flexible tube inserted through the nares into the nasopharynx to prevent the tongue from occluding the airway. The main indication of nasopharyngeal airway is current or potential oropharyngeal obstruction. The main contraindication of this nasopharyngeal airway is facial fractures or basilar skull fracture, or in case of coagulopathy. The size or measurement of the nasopharyngeal airway, it can be done by from the nostril to the ipsilateral tragus. From the nostrils to the ipsilateral tragus. In this picture, the first picture, you can see that they are measuring the size of the nasopharyngeal airway. And firstly, we have to lubricate the tube. The nasopharyngeal airway, we have to lubricate. Consider the topical decongestant to decrease the risk of epistaxis, like oxymetazoline can be used as a decongestant. Then select the wide nostril, insert gently without forcing. Aim posteriorly, not superiorly. Then twist the tube back and forth for ease of passage. If resistance is encountered, stop the attempt and start on contralateral nostril. So, in insertion, firstly what we have to do is we have to lubricate the tube. Then it is better to apply a decongestant also. Then select a wide nostril, insert gently without forcing, aim posteriorly, not superiorly. Not if we are aim superiorly, there may be chance for the obstruction. So if we aim posteriorly, it will easily insert. Then twist the tube back and forth for ease of passage. If resistance occurred, we can stop the procedure there itself. Next airway is endotracheal tube or endotracheal tube intubation. So in endotracheal tube, here it's a flexible hollow tube designed to enter trachea via oropharynx or the nasopharynx, facilitate the gas exchange and protect the airway from aspiration. So in endotracheal intubation, here we are placement of an ET tube in the trachea below the vocal cords. Endotracheal intubation can be done via orotracheal intubation or nasotracheal intubation. The common technique is orotracheal intubation. There are a different size used for ET tube, and the tube that will help to maintain airway patency and prevent aspiration. The size that is based on the height and weight of the patient. Next one, supraglottic airway devices. Advanced airway devices that occlude the distal oropharynx to facilitate positive pressure ventilation in the absence of endotracheal tube. The main indications are advanced airway management, failed endotracheal intubation, surgical procedures requiring general anesthesia, not required endotracheal intubation. The main contraindication is epiglottitis, then conscious patient with intact gag reflex. The devices are in supraglottic airway. First one, laryngeal mask airway. Laryngeal mask airway is a supraglottic device consisting of an inflatable mask attached to the end of the tube. So in this picture you can see that there is a inflatable mask that is attached to the end of the tube. There are different size of LMA, that is small adult is size 3, medium adult size is 4, large adult the size is 5. So these are the three main size for the patient. While doing the procedure of supraglottic airway, firstly we have to choose the appropriate size. Then we have to check the cuffs in order to identify any leakage. Then lubricate the device. Then place the patient in a sniffing position. Then open the mouth wide. Then hold the device firmly and insert the device. And the insertion should be smoothly along the hard palate and downwards with the outlet facing gradually. Then insert the tube rotated 45 to 90 degree from midline until past the base of the tongue, where it should be rotated back to the midline. Stop when the device is past the base of the tongue and resistance is felt. And then inflate the cuff and confirm the position of the tube placement. Another tube is combi tube or double lumen airway tube. It's a type of endotracheal tube which is used in tracheal intubation during thoracic surgery and other medical conditions to achieve selective one-sided ventilation of either the right or the left lung. In this picture you can see the procedure.